Diabetes is one of the most common conditions prevalent to mankind. It's all around the world. Doesn't matter the culture, the background, which part of the world. People have diabetes, they've had it for thousands of years, and it's very specifically the label to when the sugar, or usually specifically the glucose in the blood, is higher than a certain acceptable level. There's two major organs that are involved with that. There's the pancreas and there's the liver. The liver's job is to regulate the glucose level in the blood, and the pancreas has a role in insulin and making sure that insulin can then get inside the cells. So there's two types of diabetes, there's type 1 and type 2, but one of the main drugs that a Western physician uses is metformin, or Diabex. That's the main drug used usually all around the world for anyone with diabetes, and that drug is actually herbal extract. Someone with diabetes, first thing, find a herbal supplement, see a herbalist that can use some herbs that have traditionally been used for blood sugar. The two most common ones are cinnamon and fenugreek. There's different studies around the world that they've used to lower blood sugar. Fenugreek usually about 30 grams a day. That's a good tablespoon and a half. That's a huge amount. Cinnamon, about the same. The second thing would be get on some liver support and make sure the liver's supported, because the liver monitors the glucose, it monitors the fat, it monitors all sorts of different things in the body, so you want to support that organ. The third thing is, if you're overweight, lose weight safely. You know, see your GP, see your naturopath, do some safe exercise, do some safe detox programs, change your nutrition so that you've seen a nutrition, you've got some support, because being overweight is a huge contributor. Exercise, you know, check with your GP, make sure you don't have a cardiac condition, do some light movement, make sure you're moving. And then fifthly, you know, get a checkup and make sure you're not following in your family's footsteps, because if both your parents had diabetes at a certain age, there's a huge chance that you'll get it at some point as well. So make sure that you're proactive, because by the time you have diabetes, it's too late. So make sure 5 or 10 years before you're already doing these things, because you can sometimes be doing everything right and these conditions still show up.